more just coming on into the meeting, and we will go ahead and get started. So, welcome to today's event titled "Building Partnerships to Advance Inclusive Team Science." My name is Kate Williamson, and I'm a postdoctoral research associate with the Collaboratory on School and Child Health. On behalf of the Collaboratory, we are so happy to have you join us today, and we would like to take a moment and thank our co-sponsor, which is UConn's Institute for Collaboration on Health, Intervention, and Policy, also known as INCHIP. Before we introduce our panelists, I'd like to share a little background about the Collaboratory. The Collaboratory on School and Child Health, or CSCH as we call it, the first of many acronyms you'll hear today, was founded in 2015. Its mission is to facilitate innovative and impactful connections across research, policy, and practice arenas to advance equity in school and child health. And we seek to do this work through a commitment to anti-racist work that prioritizes inclusion, reduces disparities, and creates systemic change. At the Collaboratory, we have 6 main goals, and one of those is team science. With our team science goal, we focus on building of partnerships. And we have 2 examples of partnership teams here to chat with us today about some of the nuts and bolts of how they have built their partnerships and gone about this work. Now I'm happy to introduce our panelists. First up, we have Beth Russell and Gina Bracey. Beth is an associate professor in UConn's Department of Human Development and Family Sciences. She is director of the Center for Applied Research in Human Development, or CARD, and she is co-director of the Collaboratory. Gina Bracey is associate vice president of School and Community Initiatives at the Child Health and Develop Institute, CHDI. She also sits on our Collaboratory Steering Committee. CHDI works to both reduce juvenile justice involvement and improve school mental health outcomes through a project called the School-Based Diversion Initiative. And through Beth's work with CARD, she serves as the evaluator of that project. Next, we have our panelists Sandy Chafulias and Marlene Schwartz. Sandy is a Board of Trustees Distinguished Professor in UConn's Department of Educational Psychology, and she is co-director of the Collaboratory. Marlene is a professor in UConn's Department of Human Development and Family Sciences, and she is the director of the Rudd Center for Food Policy and Health. Together, they have worked on projects involving the whole school, whole community, whole child model, also known as WISC, which has been around for about 10 years now. All right, introductions out of the way. Thank you everybody who joined the meeting while we were getting started. So let's jump into our panel discussion. First up, for Beth and Gina, can you give us a bit of background and tell us how your partnership was formed? You have different organizations, different timelines, different missions within those organizations and your work. So we're interested in learning, how did you come together and how did the Collaboratory help you make this team?
So hi, everybody. It's great to see so many people joining us today. Gina and I both sit on the steering committee for the Collaboratory for School and Child Health back when we first met. And it was through those intersecting interests where we got to know each other. At that point, we weren't working on any projects together. I wasn't evaluating anything through CHDI as the director of CARD or as one of the evaluators in that center. But we would come together for meetings and get to know each other's shared sort of areas of interest through that setting. So that was our first introduction. Gina, I'll leave it to you to introduce SBDI specifically a little bit more.
Sure. Thank you, Beth, and thank you for that introduction. Again, I'm Gina Bracey with the Child Health and Development Institute, and our organization, we're an independent nonprofit intermediary organization, and our goal is really advancing effective systems, practices, and policies in children's mental health. So while we're not a direct service organization, we, by design, work in collaboration with others. And so that's state agency partners, behavioral health providers, schools, policymakers, and academic partners and researchers like Beth and her team So the School-Based Diversion Initiative, or SBDI, has been ongoing since 2009, actually. And so it was an ongoing project designed to work with schools to help them keep kids out of the juvenile justice system, and by linking them with behavioral health services and supports where appropriate. And we had an opportunity to engage a new program evaluator. And as Beth mentioned, we had this sort of existing relationship. And I think what was important for us from the beginning as well is that we had a very similar approach to how we do our work, and sort of shared goals in terms of how do we answer specific questions about this specific initiative? How do we know it's working? What kinds of things do we need to look for to understand what's working well, and how to best share out that information in a report that's going to be effective both for us as program implementers, but also our funders that we report to. And so it was really just great timing that all of those things fell into place and that we were able to engage in this partnership.
I think the only other thing I would say is that, we had built a communication style together. We had gotten to know each other through other networks and other conversations on a broad range of topics that were related to the work that CHDI needed done for SBDI eventually. And through that, we had built a communication style and a good deal of trust with each other for approaching what can be some sensitive and difficult or complex problems to solve. And so that was the great sort of foundation that helped us engage in a conversation about whether or not the SBDI project would be a good fit for both of us to partner around.
Wonderful. Thank you so much. So now turning to Sandy and Marlene, you two are both at UConn, so working within the same larger organization. But you came to partnerships from very different backgrounds still, and different areas of expertise. So same question for you both. How did you come together, and how did the collaboratory help you make this team?
Sure, I can answer that. So the Red Center moved to the University of Connecticut in 2015. And that whole first year, I spent a lot of time meeting everyone who people told me that I needed to meet. And Sandy was on that list. And what I remember of the first time we met, which was in her office, was talking about our research. And Sandy mentioned a project looking at social emotional policies and in school settings, and a study that she was doing where she was really collecting those policies and, trying to understand them. And I was like, I do policies in schools too. And so we felt like, we sort of understood the process that each other's research took, even though the actual content was different. And then I feel like there were a lot of sort of very lucky coincidences. Like one was the WISC model that you mentioned came out in 2014. So that was just a year earlier than when we met. So it was still new, but it was a way of really connecting, the sort of whole child model, looking at all these different areas of student health. And we realized pretty early on that we could sort of plot our expertise on that model, and it really helped our work fit together. And then the collaboratory was also getting started, so I was involved with that. And so I think we were given a lot of structure to try to plan our early projects because it was part of the collaboratory's work. And there was also a seed grant offered through InChip to do a project around the WISC model, and we applied for that. And so then that really gave us a very concrete project that we could use to fund a graduate student to develop a measure, the WellSat WISC, which we worked on for quite a long time. And then that really set us up to be prepared to apply for other sources of funding that allow us to work together.
Yeah, I think that's what's really interesting to me in listening to Gina and Beth's story and Marlene's story is that a lot of it is about the fit for the partnership, and you don't know about fit until you're out kind of exploring and doing some networking and trying to figure it out. I wouldn't say probably for either of us, but certainly for Marlene and I, even though we like to both say it's interesting that we're both trained as psychologists, but we are completely at different spaces in terms of the content expertise that we have. But there was so much alignment in the way we do our work, or why we do the applied work that we do, how we approach wanting to work with systems and states and agencies in the work that we do. So it's very interesting to have come from similar backgrounds, but doing very different work, but it's the kind of common core of the alignment. And not to say that it was like this magic day, right? That we met each other and everything's been perfect, because we do speak somewhat different languages in the different areas that we work in. It's been kind of a beautiful experience over the past few years of taking that WISC model and trying to figure out, how do we interpret that? How are schools interpreting that? Because that, we also learned, is maybe different than maybe what we thought. And so this kind of undergirding it all is the willingness to continue in this shared purpose, even though the ride may be a little different than maybe what we each set out thinking we were going to do, if that makes sense.
Yeah, no, I mean, I do think the fact that we were both trained as psychologists helped. At least we had, so we sort of came from the same place and both kind of came to, I think, our interests, over years of doing work in the field, and then realizing we wanted to focus on, making systems change. So, yeah. It was a beautiful day, Sandy, though.
It was a beautiful day. Yeah, it was always a beautiful day, of course. But, I think the other part of that, and I want to emphasize too, is that I like to talk about how I think a lot of the work we do is a bit of like a Rubik's Cube, because it's about fitting our team and getting your team aligned. But because we're in an applied space, it's also about the outer or the external connections. Gina mentioned that as well, because her entire organization is one of those bridging organizations and all of that. So it was interesting that Marlene and I also kind of knew some of these same external people,
Right.
And how could we do a better job in our partnership to be able to work more effectively with them, instead of having individual people constantly going to the door and saying, hey, we're doing this, hey, we're doing that. Well, now here's an organizing framework. This is how we can each contribute, and how can this be beneficial in the work that you're doing, and whose voices are we missing? That was a lot of our earlier conversations too.
Mm-hmm.
That's helpful enough, Kate?
Absolutely. It's very interesting to hear how both partnerships, your origin stories, so to speak. So now transitioning to thinking about practices. So coming together might be one thing, finding the shared project or goal to work on. Then what are you doing day in and day out that we might consider to kind of be key best practices in terms of teaming? And maybe how that has changed over time from when you were initially partnered up to now, if anybody wants to speak to that.
So I'll circle back to the communication habits that I think underpin the partnership that I have with Gina. It is a explicit practice that I am always looking to be patient, encouraging, cheerful. I am excited about our work, and I want that to show in all of my communications with CHDI, so that they know that while I might be enthusiastic and have a lot of energy, I'm not pushing my own timeline necessarily, right? So my communication is meant to be positive and energetic, but it also is balanced by patience and curiosity, being open to somebody else's timeline or somebody else's resource availability at any given moment. Make sure that just because there might be something that's really like caught my attention or is prioritized for Gina, whether it's internal for her organization or from her funders, we all recognize that we're going to listen to each other's shifting landscapes to try and find those opportunities that create a nurturing step forward towards doing the work a little bit better that doesn't compromise our partnership ever. And so there's a lot of trust that goes into building that communication, and a lot of inquisitiveness. Partnering means sharing, and that means being open to sharing ideas, sharing curiosity, sharing constraints, sharing limitations, or sharing worries or anxieties that might also be part of the problem space together. And that communication habit just takes some time, but it also, I think, requires some intentionality, really approaching the work as a positive, shared, collaborative space that you're building. Gina, is there anything else you would add? I'm cognizant that I'm talking from the evaluator perspective.
No, you use the exact same words that I would use in terms of communication and trust and even some of that openness and I would say flexibility. I think one of the things that we really value about your approach and the approach that we've been able to kind of build together in this partnership is opportunities to co-create the work. So while we have specific goals for the program and the initiative and what we want from the evaluation, we also seek out your expertise from you and your team and helping us enhance and improve the work over time. And so being able to kind of find what are the best methods for answering the specific questions we want to answer. How do we, get the best, identify the best outcomes and report those out? How do we consider things that we hadn't even thought about, that you and your team have brought to us and say, hey, have you considered looking at it this way? And it's like, no, that's a great idea. Or have you considered doing additional qualitative interviews? And like, no, we hadn't really considered that. And so let's talk through that and what would that look like and how can we fit that in? And so that trust really extends to being flexible over time to grow and shape our evaluation together over time, which has been really helpful. And you did sort of allude to some of the challenges without necessarily calling them challenges, but I will put out there we've had a few challenges in terms of our end, in terms of funding or contracting delays, certainly from the implementation of the work overlapping with COVID and, the time when schools were shut down pretty much, and there was very limited implementation of the specific type of work that we do in school buildings. And so how do you capture that from an evaluation standpoint can be very tricky. And so being willing, to work through that process with us of how do we even write this up and, what data do we have to even show what the work has been doing has been very impactful over time. And the final thing that I would add is in terms of, when we're talking about partnerships and teaming, you and I are just one person from each of our respective organizations with lots of people on our teams. And, you even have had existing relationships with some of those partners in terms of our state funding partners and agencies, or even some of the schools. And so sometimes there's a navigating those multi-layer relationships, from a lens of a different project that come into play. And so, again, it all goes back to communication. And so having an open communication line so that we can talk through those things and work through any potential challenges has been very effective to our partnership.
Kate, you mentioned best practices, and one of the themes that I think I would point to from our history on SBDI as a partnership is knowing your problem space, knowing the other stakeholders that are in that broader area. So certainly paying quite a bit of attention to the relationship between our two organizations, or even more on a more micro level between my relationship with me and Gina, but also extending that awareness outward. So knowing about the Department of Education or the Department of Juvenile Justice or DCF, right? Knowing what other stakeholders are in this problem space so that we are paying attention to how what we co-create, even on that really small level, might be interesting to and relevant to external agencies, external opportunities that might encourage us to share or disseminate some of our findings in particular ways or to particular audiences or at particular times, or just encourage us to be aware of how the landscape is shifting and where resources might become more available or more constrained as we move forward. So that awareness, right? Awareness of the landscape, both on the small level and reaching outward.
I think that's really interesting. I think Marlene we'll probably jump in on that too, but I just wanted to say, I think a lot of what we're talking about is about the fit. So I was just going to tell the story that when we started in 2015 in our partnership and that WISC model had first come out in 2014, I'm not sure that we had a whole lot of buy-in. Like somehow we believed in this model and people could look at it and say, yeah, that's interesting. But then the wholesale jump or the interest or the alignment or the of the interest maybe wasn't quite where we wanted it to be in that excitement, but we kept plugging along and now we do have that. So I don't know if that's where you're going to go next, Marlene, with your space, and then I'll circle back on one other thing.
So I agree. I mean, I remember meeting with the Department of Education and really trying to share our enthusiasm for this model and the fact that we both had relationships with them already and trying to show how it all fit together, I feel like was important. And indeed, we were able to sort of leverage that into some state funding that we shared and worked on. The other thing I was going to mention, if I think about sort of why I feel like, like a way that we've sort of connected and has made the connection feel very rich and deep, is that we also have shared sort of mentorship of graduate students and postdocs. And so, there have been a number of, and even some undergraduates over the years, that as we've, even if one of us is doing a project that the other one isn't as deeply in, like, working on, like if I think of the summer meal project, I was like, I need 10 undergraduates this summer to help collect data at summer meal sites. And so I was able to sort of tap into the folks that you were working with. And then, you were on the committee of one of my graduate students. And I just feel like that, offering, opportunities to write papers and do presentations and things like that, sharing all of the trainees has made the relationship feel, really strong to me, and made it also feel like it was more than just the two of us.
Definitely. And the other space I was going to go in is, I think, like, I absolutely agree with trust. Like, so don't get me wrong when I talk about this with communication, but I think a really undertapped space to think about in what we mean about communication is building the teaming structures. So when we started our partnership, it was kind of me, Marlene, and a couple of grad students sitting around a table we could fit in my office. And now the projects that we have pretty big teams, and they're more complex with more partners. And that does make it harder to figure out, okay, what platforms are we going to use, right? Even just getting on this platform today versus other choices. How do we want to use different naming conventions? Can we get on board with that, and how we want to file structures and all kinds of things that is not really the most exciting part about projects, but can really make or break people's ability to find information, to feel comfortable with the information. And it's all part of the kind of the undergird of that relationship and partnership. So my tip or my piece of advice is not to neglect the amount of kind of effort or attention that does need to be spent on doing that in ways that bring to that partnership to a new level.
Mm-hmm.
Not that we have it perfect, believe me. It's still beautiful, but we still have to reinvent different spaces or tweak things all the time, right?
Yeah, no, but you're right, because we sort of each had our own filing systems and our own places we were tracking things, and so Kate's helped us get organized.
Yeah. For how often to meet and who needs what amount of supervision. It's harder the more complex the teams get, right?
Yeah.
And who's watching which ball on which part.
Mm-hmm. Mm-hmm.
Absolutely.
Kate, part of your question was about time. And one of the things that I'll say is that people come and go, right? That organizations change, and the problem space evolves with time too. And so I think while you might come together around a shared interest, maybe from a small seed grant opportunity like our colleagues, or because a time-sensitive need emerges, as was the case for our partnership, understanding that you don't want to take for granted what other people might know or not know about an agency, because those agencies themselves will change with time as the staff there change, or as certainly is the case in my team. Gina's great at being patient with us, because as I am bringing in graduate students and training them, they are in fact being trained to graduate, to leave, and to go on and be successful, which means I'm constantly bringing in new faces who need more training because they're junior. And so, we really do have almost like an introduction to the team meeting almost every year to make sure we are staying connected and not making assumptions about who's still here and what they might know or not know. And so you can come together because you have a core set of information or knowledge or background in an area, but staying curious and staying open to meeting new people and rethinking the way the team is configured or what they might need in that moment is a great way to stay agile over the course of time.
I love what you said, Beth, because that really tied together several pieces there, right? Because if we have the structures in place, we have the trust and we have the communication, we can adapt over time for these projects as new people come and go, as the landscape changes, as COVID interrupted all of school and health and food services and everything and like that. So I love that point there. So before we transition and hear about, oh, sorry, Sandy, go ahead.
Oh, I was just going to expand one more little thing. I
Absolutely.
think because we have been able to put some of those things in place, we've actually also gotten a lot better about stopping and reflecting on what's missing, right? Because oftentimes when you're getting going and you're just trying to get it started, maybe you don't pause as much to stop and ask, okay, what are the voices that aren't being included in these conversations? And maybe they're not going to be a full new partner on there, but how are we making sure that we're going out and collecting that evidence? And I bet that's probably some of what Gina and Beth were talking about earlier about, well, maybe we need to do more focus groups or more qualitative work to make sure that we're understanding the data that we're getting from this. And so I think that's part of where we're trying to go with the work that we're doing in the collaboratory, of course, around inclusive team science. And how do you take team science, which is already complex, right, but elevate it even further to make sure that these partnerships are being created in ways that can foster equity in both the teaming process and in the outcomes that they're trying to generate. I don't know if that's helpful to add.
Absolutely.
But you can't ask those tough questions until you build the structures and the trust, right?
Trust.
I mean, You can ask them, but they're more receptive to say, hey, I think we made a mistake here, or what have we missed out on here?
And you set up that team culture when you do have new graduate students coming in every 2-3 years, or community partners that Gina's working with changing potentially, et cetera. Absolutely. So before we transition to the exciting work you are all doing right now and your goals for the future, I'm sure everybody's interested to hear more about your projects themselves and their current status. I do want to think about those who might be on this call who are thinking, how do I get started? How do I make myself a good fit for somebody's partner? Or how do I find a partner? And I know you all are, dedicated in your being with the collaboratory CSCH and expanding, sharing what you've learned over the years. So what would you say to those who might be on the call who are thinking, how do I set myself up to be a good partner? Or where do I find a partner and get started?
Well, my first piece of advice is to be curious and to be open and to start learning about that problem landscape that you probably already have some background in, that you're already motivated to dig in deeper around, or you've got a real awareness that you need a partner in order to do the work. Start learning a bit about the bigger context that problem space is in, because that's how you're going to meet people. And as strange as some of those network events can feel with their icebreaker activities, they're really worth their weight in gold in finding people who you communicate with or who you have that synergy with, where you feel like the communication, the trust, the timing, the resources all seem to fall into place. So meeting people and networking really is a great way to understand the landscape of the problem space that you're curious about, because they are all unique. And I just encourage you to be open-minded. Remember that shared work means sharing. So being willing to extend your maybe it's just the beginning of a plan for a project, or it's a wild idea you had while you were on run last week, but starting to go out on a limb a little bit if you can, and express your curiosity, express your motivation or your interest, to ask questions and to try not to sort of second guess the legitimacy of being curious and inquiring what's going on or who else is in the space, and just to start to be present and be present with your curiosity, even with what I would call your beginner's mind, right? You're at the beginning of a new project or a new partnership or a new team. And that means a lot of learning is going to happen. So being gentle with yourself and gentle with everybody else in that space as you try and understand who's also there and what resources they have or what appetites they have, so that you can try and find those shared synergies is really like that's my biggest piece of starting advice. Be curious, be a little brave, learn the landscape.
Yeah, I totally agree with what Beth said. And I think along with that, sort of feeling curious and being open is being clear about or thinking broadly about what your interests are and your skill set. Because again, when we were looking for an evaluator for the school-based diversion initiative, well, it's not like anybody's out there saying, I'm an evaluator for school-based diversion initiative. It's a perfect fit. It's, or maybe you haven't even evaluated a juvenile justice diversion program before or a mental health, connection program. But it's really about, what are the specific methods that we're looking for? Maybe you have expertise in that, or that you have expertise in school-based work that's aligned with this space. And so, thinking broadly about what that potential match might be is another way to kind of really market yourself, your skills, your abilities, and make a match that way. In addition to the networking opportunities, I would echo that those have been really helpful for me as well. And even though, each time I've been to one that the collaboratory has hosted, even, I'm always taking notes. I'm like, oh, that's an interesting area of work that they're doing, or this is a great sounding project. Maybe there's a future opportunity for some alignment. And if, those in-person or direct communication kind of things are daunting or not really your thing, you can always get on newsletters or listservs and get information about what's happening. People are always posting about their new projects or new opportunities. And that's another way to sort of learn and track who's doing what in the field or in the space that you're most interested in.
I would also push not to be afraid to send that direct email. It may go nowhere, but it goes nowhere if you don't do it either, right? So I think a lot about what we're talking about now is like kind of the exploring stage of like, do I even need a partnership or a team around what I'm thinking about? And I would say the majority of my explorations maybe fail at the initial stages, but maybe they come back in a few years. I'm looking at Christine Montgomery here from Clifford Beers, and I've known you forever, right? And I actually think that I may have met Gina through my connections with Clifford Beers originally. And, projects and priorities have to ebb and flow over time, but you never know when they're going to come back around at different spaces and different opportunities. And I think that's okay, right? Just to say, hey, this is a good time. I really like this. It's not a good time for me, but it's not a good fit. And that's, I think, just as important to understand. Then you can ask if you have the right people and then if you should actually plan forward with a project.
Yeah, I agree with everything people have said. And I will say I've only worked at 2 universities, but UConn really takes networking much more seriously. And I feel like people genuinely want to connect with each other and work together. And so I've found it just a really welcoming environment. And there are a lot of events with, CSCH and InChip and other opportunities to just meet people. And I have done those cold emails where you sort of are looking for someone who has a particular expertise. And I've found that people really are receptive. So I think it's this culture, I think at UConn really facilitates that.
Wonderful. And now to learn a little more about where your projects are right now in the future and looking very quickly into 2024, which is crazy. What's the current status of your project or your partnership, and what are your current goals and exciting things you're working on? I'll toss it to you, Sandy and Marlene first.
Do you want to? Well, so it is super exciting. I mean, as Sandy said, like that, the WISC model came out in 2014, and people, were excited about it in theory, but it's felt like it's taken a number of years for there to be a lot of sort of concrete opportunities to put it into practice. And so luckily the CDC, which is one of the big proponents of the WISC model, did have an opportunity for a cooperative agreement. And I will say just so it doesn't sound like, oh, it's been so easy. There actually had been a previous CDC grant that we applied for that we did not get. But we saw then a second one that we felt like we also would be a particularly good fit for, and we applied and got it. So that is very exciting. And basically, the project has 2 components. It's a 5-year cooperative agreement, and one component is to really do sort of technical assistance and training at the state level in terms of helping school districts implement the WISC model, and what that means is something that we are working on. And then to also work specifically with one priority school district, and we're working with East Hartford. And part of why I think the whole thing came together so beautifully, because of course there's never a lot of lead time to get these things done, is we had already worked with East Hartford specifically on a previous project. And so when we called and said, you know, we have a grant deadline in 2 weeks, can you get us a letter? They were able to do that, which frankly was a miracle. And I just felt like, you know, even in our application, we could talk about all the work we had already done statewide and the partnerships we already had with the Department of Education and our Department of Public Health, you know, came to the table very quickly. So it definitely felt like a lot of things fell into place, plus an awesome team that we have. So Sandy, would you like to add more to that?
No, I think you actually covered it, right? So it's like, and it's brand new. We should say that part, right? So we just are kicking off into that first quarter. So we just got time 2 weeks ago now, I guess, to spend time at the CDC for 3 days with the 20 other states and our teams that were funded around the country. And some of them were funded in that 2018 call, right? So they're building from here, and many of us are starting from scratch, but we feel really lucky that we're not starting from scratch because we had built all of these kind of lead up pieces and kind of know what directions we want to go in. A lot of it for now for us is the exciting challenge of working with the external groups, right? And figuring out what's the best fit and how do we align with what different key groups are doing already? How do we offer benefit in the kinds of things that this can do? So it's not just another initiative or initiative fatigue. And we're just so excited to be partnering with East Hartford and our primary partner there, Tracy Stefano, who is all in the physical and health education space, which adds another piece to our circles, right? So we're like, okay, I've learned so much just in the few weeks of working with Tracy, things I just didn't know about health education, for example, in the state, and how important that is, and how it does intersect with the psychological things that I do.
Mm-hmm.
I think you covered a lot of it, though.
Yeah. No, it is exciting. And another advantage, in addition to the advantage of being at UConn, I think an advantage of Connecticut is we're so small. And so it really is, I feel like there's not very many degrees of separation between you and other people who do the type of work you're interested in. So that I feel like has, you know, even in putting that grant application together, it felt like we were able to identify a lot of partners because, you know, the state isn't that big, and there's sort of a lot of key players that you get to know if you've been working in the space for a while.
Like CHDI. Right. So I think Gina even was one of our support letter writers in terms of pulling that grant in, and we're going to be circling back soon on their new grants, on the Connect 4 grants, because there's a lot of alignment and overlap that we shouldn't be duplicating efforts. So exciting.
Yeah, absolutely. Yeah, and that's actually what I was going to say in terms of what's next for us. I mean, in the immediate next step is continuing and sustaining our partnership together with Beth for the SBDI evaluation. So it's time for contract renewals, and continuing that relationship is very important to all of us. And beyond that, we're waiting another pending funding opportunity to expand our SBDI model to an early intervention elementary version of our approach. Currently, it's middle and high schools. And so, again, building and integrating in the evaluation component into that would be very important, and continuing our partnership on that to expand the model, which is super exciting. And then, I think we've also been talking now, I think we're at a good space now we can start to think about disseminating the model and through publications and, potentially presentations at conferences and things like that to kind of, again, share the outcomes, share the model, share the partnership, and always looking for future opportunities to maintain and expand this role as well.
The mute button. The mute button, my friends. How many years in and I still miss that mute button? So one of the things that I'm very excited about for SBDI is that we're able to look at the year ahead and maybe even the year after that as an opportunity to reach into spaces that maybe weren't tenable at the beginning of our partnership as we were getting our feet under us and really getting into good work habits together. This upcoming year, we'll be expanding our qualitative work to talk to more and more stakeholders that are touched by SBDI. Not just talking to the staff who are at the schools implementing, but now also talking to a few more people behind the scenes about what the origin story of diversion initiatives was and the particular hopes and opportunities that led CHDI to launch their program here in Connecticut. We're also hoping to support CHDI in strengthening the fidelity of the program. And as Gina mentioned, that's really geared towards how we might tell the story to a broader and broader audience to inspire more states, more districts to get involved in restorative practices and build models that do scale well to keep kids in schools and out of the juvenile justice system.
Fantastic. Now, before we open it up to Q&A, I just want to throw it out to all four of our panelists. If there's anything else that you wanted to mention about establishing your partnership, those key teaming practices, setting somebody up to be a good partner, or anything like that before we open it up.
I think I would just advocate. There are a lot of tools out there to help you make some of these decisions. Some things happen organically for sure, right? But many things should be purposeful in helping you be more efficient and effective at making the decisions about what you want to do. So, we very much in the work that we do in CSCH work within implementation frameworks for sure to understand what kinds of questions you should be asking at different stages in partnerships. And then even when you're in an established partnership, things do happen. There are challenges. When I'm struggling as a leader, what are some things that I could use or activities that I could do or things that I can be thinking about to help me along the way? So, I would really advocate along the way to set yourself a process roadmap, because there isn't teams don't come with manuals, but it could be a lot easier for you as a leader or as someone engaging in partnerships to be thinking about critical questions at different stages along the way. And the good news about that is that there are more resources that are growing out there. It used to be that only the National Cancer Institute and NCI had materials on team science, but it's become a very growing area to be looking at.
That made me think of one thing to add as well, Sandy, also thinking about your criteria for saying no, right? So we're talking about, opportunities and reasons why you would engage in partnership. And there are some times when you might get a request that doesn't fit with your goals or your resources or your opportunities, and you do have to say no. And so thinking very clearly about what those boundaries are for you, especially, I think it's clear how well Beth and I work together. And so, of course, I don't want to tell her no if she were to come with some opportunity, but it may not be the right timing or the right opportunity. Or so, again, kind of framing that for yourself so you're clear and ready when those requests do come up, that you have a standard or some decision-making criteria for yourself for that as well.
Yeah, I think, one of the themes that I've heard us all talk about is that things have to align. There needs to be fit. And that it's easy for us to talk about the moments where that works or where we've felt success there, but there are also moments where you're not aligned. The timing isn't right. That grant's not going to hit in 2018, or that partner might be overwhelmed and understaffed right now. But 2 years later, 3 years later, 6 months later, maybe there's a renewed interest or another opportunity or a new team member. So even when you do need to set boundaries, and they are important, and you do want to do that with intention, part of the intention should be to establish them in a respectful way that protects the trust and communication that you have with your partners, your future partners even, so that the no's don't become injuries. They become, not this time. I'd love to talk to you next time.
I love that. I love that. All right, so we've got a few minutes left, so we can ask some questions of our panelists. If you have a question, please raise your hand, and once we call on you, you can unmute yourself to ask your question, or if it's easier and you're staying off camera, please feel free to put your question in the chat, and we'll take the next 10, 11 minutes to go through some questions. Yes, Christine, let me see if I can unmute you. Go ahead, Christine.
Thanks. Hi, everyone. So, hi, lots of familiar faces, which is great. So at some point during the discussion today, you talked about kind of bringing new team members in. And I'm wondering if you can, because I find that sometimes, I don't want to say the work gets stalled, but it definitely slows as we kind of integrate in new team members and deal with transitions. And I'm wondering if you can speak about any strategies that you found that help with that, like having a one-on-one before the person joins, any concrete strategies to kind of move that pace, to not break the pace, I guess, of the work.
I'll say again, it's the not exciting parts about the back end teaming structures and ways that you've organized things for people to be able to onboard more quickly is critical. And it's mistakes I made back, in prior grants, even the naming conventions or the way we set up systems on the grant that Marlene was talking about before she came on board with us is where we actually did learn a lot of our mistakes about bringing people in more seamless ways. The other thing that we have done, which isn't part of this, but it's part of my other labs, I have a number of different institutions that are involved in my projects, but we have a lot of staff that are kind of shared across. And so we did set up time, thanks to Ellen, I guess 2 years ago, to create a very detailed manual that all of the teams can be using about how we do different things and structures. And when we bring a new person on, that's the first thing that they're given as part of some of their required UConn HR tasks that take forever to get done too, right? And that's just one of the things that gets embedded into that onboarding process. And it is more helpful, and you're not feeling like you're doing everything from scratch all over again. That would be my advice. And again, it's not the super exciting part, right? But we've learned by mistake about how important that is.
I always try and find like the first point of contact that makes the most sense for any new team member. So oftentimes that's their direct supervisor, and they're going to spend a lot of time in that one-on-one context, sort of learning the culture, the feel, the space, the habits of their new employment situation. But part of that is also starting the conversations about what it's like to be a part of a team that might be partnering outside that organization. And those early communications can happen within the supervisory relationship, but keeping your eye on who the next point of contact will be. So on our team with SBDI, I currently have, I think, 3 different trainees, and each of them does a different piece of the work, which might need them to be in touch with someone different on Gina's team. So if we have a data question, if Yu Yang has a data question, he might reach out to Kayla. Or if Sabrina has a qualitative interview question, she might reach out to Rebecca. Like there are different points of contact that make sense for your newest team members to start their relationship building, because that might be the point of contact that they're going to need to forge their own close relationship with. So I tend to steer away from bringing my newest team members to big, everybody is sitting around the table and they get kind of introduced to the 90 faces that are in the room, and instead try to do a little back channeling so that they're given the meaningful first point of contact first. And then they come to the big quarterly meeting and get the big introduction. But you try and give them a friendly face, right? Try and give them a meaningful, friendly face as a starting point to that partnership.
I would just add one piece to, as much as possible for those planned transitions for when students come and go at the beginning or end of an academic year, those kinds of things, we have as much as possible sort of built that into the contract and the deliverables in terms of the way the work rolls out also to be less disruptive as possible. And that's another one of the potential challenge areas of, our organization, we run on a fiscal year that's October 1 to September 30th, but this particular project is the state fiscal year, July 1 through June 30th. Of course, we're working on school years, with K through 12 school years. And then the, UConn is on their academic calendar. And so all of these things are happening at different times, and we have people coming and going at different times, the ones that you can plan. And of course, there are unplanned transitions of staff at times as well. And so as much as possible, we have built in their specific deadlines for when they need to get things to us at a time that makes sense for them to onboard new teams at the beginning of the year, and to be able to roll out as seamlessly as possible along those dates where we know there will be some transition or lag.
A concrete example of that is that Gina mentioned the contracting process. So any partnership is going to require some degree of contracting. And I'm with Sandy on this one. The back end unexciting part of this is actually putting in place those codified documents. And sometimes they're pretty simple, but they are important, and they take time to move through the organizations. So we try and start that contract negotiation process as early as we can, so that we're not tripping up into actual deliverable deadlines on top of the contract process. And as unexciting as it is to think about, like, when are the people in the contracting office likely to be going on vacation, and can I get mine in before they sneak out? Like those 2 weeks can make a big difference in feeling like everybody's relaxed and cheerful and able to be patient, and the heat starting to get a little turned up on your timeline. So thinking about, those concrete moments of alignment, just in terms of resources and time and flexibility, can really help the new phases of work that happen as your team grows.
I think my team likes to make fun of me because I dream and sleep in school calendars. And I know Gina was just making fun of me actually last week because she said, I don't know what the academic calendar was at UConn. And I was like, well, I don't even use the UConn. I dream and think about holidays and state holidays, and never ever ask a principal after June 30th something, right? And that's certainly not 2 weeks before the school year, which is unfortunate because some of the Department of Ed grants actually came in up due that time. And we struggled substantially to get letters at that time. So just thinking and sleeping about when are teachers more willing to be ready to work with us on a project, and when's that going to fit? It's like constant. I know every school calendar.
Sure do. You sure do.
We sure do, until we started working more nationally, and we realized, hey, you know what?
Right.
Not everybody uses a school calendar like the Northeast, and we're totally like stuck because many of our school districts get out by May 1st, and we're like, oh my goodness, now we have to rethink school calendaring.
Absolutely, yeah. When you're cross-country partnerships. Absolutely. Any other questions in the last few minutes that we have together? You're right here at 1 o'clock. Well, this has been wonderful. Thank you so much. Oh, here we go. Thank you very much. The comment come in there. Appreciate that. Thank you so much, Gina, Beth, Sandy, Marlene, for joining us today. And thank you all for attending. Thank you, Sandy.
Kate for hosting, Ellen for organizing. So thank you, everyone.
Absolutely. And thank you, InChip, for co-sponsoring and helping us with our technology. If you missed any of the links or information that Ellen put in the chat, the Collaboratory on School and Child Health, CSCH, our website is very easy to remember, csch.uconn.edu. You can see all our resources and sign up for our newsletter to find out about other events. And you can also follow us on all social media platforms. Thank you, everyone, and have a wonderful day.